I think one of the things that we need to recognize that's been happening in the United States over the past decade or more has been a gap between the lifespan of people in the United States compared to other high-income countries. And that gap of life expectancy has gone from about a year to closer to 5 years, where we lag behind our 16 peer relatively high-income countries. And that's something that this commentary really points out. And a lot of that can be tied to the baseline health of people in the United States. And the baseline health of people in the United States is somewhat, and to some large extent, a function of policies. Policy ends up affecting a lot of the things that impact our health, the types of foods that we eat, the types of physical activities we're able to engage in, how educated we are, our understanding of the importance of preventing disease. A lot of these things relate to laws and policies and the way that money is spent in our areas. What we have in the United States is really quite a patchwork quilt of health policies and social determinants of health. All of that played an important role in the impact of the COVID-19 pandemic. While there is some randomness to how sick someone gets with SARS-CoV-2, there's also a lot of non-random effects on risk for getting sick. Things like comorbid conditions or the baseline health of people prior to getting infected. Being obese, having underlying diabetes, having high blood pressure or chronic organ diseases affecting things like the heart or the lungs or the kidneys absolutely made it much higher risk for people to have complications of COVID-19 or even to die of COVID-19. And there is where, for example, health policy makes a difference, because health policy can really determine how much obesity is in our communities and how much diabetes and how much high blood pressure and what populations are disproportionately affected by those underlying conditions, some of which are driven by things like racism that can be a reflection of policies and laws as well. At this point, more than 1 million excess deaths have been attributed to COVID-19, but those are not equally distributed. They've hit different communities differently. Communities of color have been disproportionately affected adversely by COVID-19. And we've also seen certain states that were able to adopt strategies for public health, that the impact of COVID-19 has been less in those states than in other states that have said, leave it up to individual people to try to respond as best as they could to the pandemic. And that has created disparities where some states have literally had tens of thousands of more lives lost than others in ways that track quite closely to the measures put in by public health to keep people safe. As an infectious disease expert, a common question that I get is, what should we be doing to prepare for the next pandemic? And I think the low-hanging fruit kinds of answers to that question are having good surveillance systems, having open, transparent communication among countries. But I think a deeper and more difficult answer to how we prepare for any pandemic infectious disease is to do the things that we need to do, which are hard work to improve the health of our people, to improve population health. Imagine if COVID-19 had hit the United States at a time when there were historically low rates of high blood pressure, obesity, and diabetes, and kidney disease, and heart disease, and lung disease. It is very clear that we would have fewer deaths and fewer episodes of severe disability because our population would have been healthier. Imagine also that we had a population who understood what public health is all about and understand that sometimes the things that we need to do to collectively keep each other out of harm's way and healthy and functional as a society come at a cost of individual choices we may want to make. And I hope that from the COVID-19 experience, we've all got a better grasp or understanding of why our health policies and our policies governing things like our economy and our jobs and our access to nutrition and care and smoking laws and gun regulations and the kinds of things that help keep us healthy are really, really fundamentally important. Can we accomplish all the things we need to improve public health and to protect ourselves against the next pandemic in a completely apolitical way? I'm not so sure, because a lot of these things that we choose to spend our money and resources on are legislated. And that legislation happens from politicians, and those politicians get elected in a democracy. And that means that we need an educated society, and we need people to have access to vote. So even things like voting restrictions, which can be very politically charged, end up mattering. So I would encourage everyone who's a healthcare professional to look around and look at the ways that we can make a difference in our community. All politics are local, and to that extent, our greatest ability to affect the health of our community begins with looking locally at the people who are crafting legislation that impacts public health.